So I appreciate you being with us to learn a little bit tonight about pelvic health in athletes. So what's pelvic health therapy? A lot of times people think about the pelvis, obviously that's in the name, pelvic health therapy. Other people will think about pregnancy, postpartum women, that things, happen during pregnancy and after pregnancy that might warrant pelvic health needs. Some people think about older people having bladder problems or bowel problems as they get older. But what we're here to talk about tonight is that it's not just about women. It's not just about getting older. And it's not just about being pregnant, having children, and not being able to do some of the things that you used to be able to do successfully. We're here to talk about it being much more common than that. You might see people will say, don't make me laugh. You're going to make me pee my pants, right? Probably heard that before. And people just laugh about that and joke about that and think, oh, that's normal. She's had kids, or that's normal. She's getting older. Or we might think about multitasking as we age, that we can cough, laugh, sneeze, and pee all at the same time. So you're a good multitasker because you can do all of those things together. And again, people will laugh about that and joke about that because we've kind of normalized those symptoms in our society. But it's not just about those women that can't laugh, or that will cough and sneeze and have to cross their legs because they're going to leak urine. It's also about athletes. What I'm hoping that you will take home from today is that pelvic floor dysfunction is universal. It's men, it's women, it's children, it's all genders of all ages. And it's even in our athletes. When we think of athletes, we think of people in the best shape of their life, and they're doing, they're really strong and they're powerful. But these athletes, we know, have a high degree of pelvic floor dysfunction. And the reason why I'm here tonight is because we also know that people are not paying attention to athletes' pelvic floor dysfunction. We see that these symptoms often go untalked about. We see that people suffer with symptoms without notifying healthcare professionals, or without trying to do anything to help themselves. So that is why I am here. What are symptoms of pelvic floor dysfunction? And this is symptoms for men, for women, for children, for athletes, for non-athletes. Symptoms of pelvic floor dysfunction might include leaking of urine or stool. So leaking any involuntary leakage. So not just, I have to wear diapers all day because I can't control my bowel or bladder, but this is, oh gosh, I can't laugh. Or if I have a coughing fit, I might have something come out that I don't want to come out. Or I can't jump on that trampoline because I might leak urine, or don't make me laugh. So it's not like the full-blown incontinence where you can't have any control. It's any involuntary leakage of urine. Another symptom of pelvic floor dysfunction might be urgency and frequency of bowel or bladder, like oh my gosh, I gotta go right now, or I can't hold it. These are the commercial, the gotta go right now. That's for bladder, but also oh my gosh, like if I have to have a bowel movement, like I better get there in a hurry, or it's going to be coming out without me wanting it. So that's the urgency piece. The frequency is I'm going all the time. I'm having multiple bowel movements a day. I'm in the bathroom all the time. I know where every single bathroom is on my way to work and on my way to visit my mom a couple hours away. I'm very familiar with which bathrooms are clean in the public, and I'm somebody who is constantly visiting the bathroom. Another sign of pelvic floor dysfunction might be constipation. I feel like we tend to normalize constipation as well, where people will just live with not having bowel movements, or straining, or having pain during bowel movements, or having really hard stools. Constipation can be a sign of pelvic floor dysfunction. We know that about 42% of people with constipation, it's actually a muscle issue. So that can be a sign of pelvic floor dysfunction. pelvic pain. So pelvic pain anywhere. That can be pain anywhere in the pelvic area. It can be pain in the genitals, in the vagina, in the testicles, in the tailbone, anywhere in that pelvic area. Can be a sign of pelvic floor dysfunction. With pain in the pelvic area, we might also see sexual symptoms of difficulty having intercourse, difficulty with penetrative intercourse because it's painful, or difficulty getting an erection, or difficulty maintaining an erection, or pain during ejaculation, or pain post-orgasm. So all of those things can be a sign of pelvic floor dysfunction. A hernia in your abdominal wall or in your inguinal canal. You've heard, I'm sure a lot of you have heard of inguinal hernias or umbilical hernias. So any protrusion in that area, or a protrusion in the vaginal area, if you're somebody that has a vagina, where things might fall, have some prolapse down into the vagina from your uterus or from your bladder or from your rectum, getting things that are not being as supported as they used to be. Back pain is another sign of pelvic floor dysfunction. We'll learn in some later slides that your back is very closely related to your pelvic floor, and it's part of your core muscles. And a lot of times people with back pain, there's such a high correlation of back pain and pelvic floor dysfunction. Unfortunately, a lot of people don't think about the pelvic floor when they're treating back pain. And we're on a mission to make that change so that people start thinking about the pelvic floor when we're working with patients with back pain. Similarly to hip pain, we'll learn in some later slides again, the relationship with the hip. If we're not thinking about the pelvic floor when we're working with people with hip pain, then we might be missing out. So if any of these symptoms of bladder issues, bowel issues, pain in the back and the pelvis and the hips, sexual issues, or pressure control issues with a hernia or a prolapse of your pelvic organs, all of those things could be symptoms of pelvic floor dysfunction. And we do see these things in our athletes. What do these symptoms cause? What are we seeing for side effects if somebody's having stool leaking or frequency, urgency, or constipation, or any of these things? We see a whole bunch of side effects, social side effects. That's I don't think I'm going to go to the movies tonight because I'm tired. But really, it might be because they have to get up so frequently during a movie to go to the bathroom, and they're limiting their social events because of that. Or, you know what, I don't think I'm going to go out to dinner tonight because my mom's up and visiting. But really, it might be because they know that once they eat in a restaurant, then they have to rush to the bathroom really quickly, and they're nervous about losing control. Or I'm not going to have a drink when I go out because I know that might make me laugh and I'm going to end up peeing my pants. So we see a huge social side effects in people that have some of these symptoms. We also see psychological side effects of depression. I can't do the things that I used to do because I'm having these symptoms. Or anxiety with hypervigilance around, what if there's not a bathroom there? I don't know if I can go to that event because I need to be close to the bathroom. What if they don't put me close to the bathroom? Or what if I'm in this person's house and I don't know where the bathroom is? Or what if I'm in this event? And, so that psychological effect of depression, I can't do the things that I used to do, anxiety with not being worried or concerned that you're going to have an accident or you're not going to be able to be close enough to situations, or that you haven't had a bowel movement and that's causing issues because we know bowels, having a bowel movement can affect, it's kind of like your second brain. It can affect everything if you can't poop. Physical side effects. So I'm not going to exercise because I'm leaking urine. I can't go on that hike because it's too hot for me to wear a pad. And I'm just not going to go. I'm not going to run that road race because of my fear of having some symptoms. So we see that taking physical toll on our body because we fear or we stop exercising. Sexual side effects. People will stop having intimate relations And then does that lead to a whole snowball of effects where that can play a role in depression? It can play a role with relationships. I've seen people, I've heard horror stories about, people having difficulty, pain during intercourse or leaking during intercourse, and then not having intercourse, and that develops into, relational things, and then can lead down a road of, I'm no longer talking to my spouse, and really unfortunate things because of potential side effects. And ultimately, that's affecting quality of life, right? Huge effects on quality of life. We've done quality of life studies with people with pelvic floor dysfunction, and we see a huge impact on quality of life. We've actually done quality of life studies on people with with multiple sclerosis, and have seen that your pelvic floor dysfunction symptoms have a more of an impact on quality of life than even their muscular symptoms. So huge impact on quality of life. But are we seeing these really in athletes? Like, athletes are healthy, right? They're in the best shape of their life. Like, they're doing it right. We're supposed to exercise, right? These things, like, athletes are strong. We shouldn't see these symptoms in athletes, but we do. We see it in recreational athletes. So people that are just, walking, going for hikes on the weekends. We see it in college athletes. People have never had children, best shape of their life. Some of them getting paid to participate in their sport. We see it in middle school athletes, young people. We see it in elite athletes, Olympians, professional sports players. I actually work doing some work with our Division I college here locally in Maine, and working with athletes on campus at the Division I college. So it's not just those pregnant, postpartum, out of shape, elderly people that we're talking about. I put together some studies to show you how prevalent these symptoms are in our athletes. This study here is a systematic review, which is a big study that came out a few years ago. So they looked at a wide age range of women, ages 12 to 69 years old. So they had 7,500 women, and they found that women who exercise were 3 times more likely to have urinary incontinence than their counterparts who did not exercise. Does that mean that we don't want people to exercise? No, it means that we need to be doing something about their symptoms. They also saw in this study that higher impact athletes were more commonly having pelvic floor side effects than lower impact athletes. For example, gymnasts or trampolinists had a very high percentage of urinary incontinence compared to swimmers. So the higher the impact, the more ground reaction force that's forced on the pelvic floor, the more likely urinary incontinence was to happen. Another study looked at recreational athletes. So these are your everyday athletes, not the college, not the elite, not the Olympians, everyday recreational athletes. They did a study with about 1,600 adult women. Again, a lot of the studies, we know in the literature that it's, when we talk about pelvic floor dysfunction in athletes, it's heavy women focused. And when I say women, just to, I mean people with vulvas and people with vaginas. I don't mean to discredit any other genders. So when I say women in the context of today, I'm meaning people with vulvas and vaginas. We know that people with penises they're not studied as much in the literature in this realm. I think that's changing. We're starting to see more studies come out with men with pelvic floor dysfunction, but a lot of the studies with men with pelvic floor dysfunction we're seeing in post-prostatectomy surgeries where they're having their prostate removed, or with people with erectile dysfunction, and less so with athletes with pelvic pain or with lower urinary tract symptoms or constipation bowel symptoms. But in this study here, 70% of these women were having urinary incontinence. 70%. That's huge. 52% were having bowel or anal incontinence. So they're not able to control their bowels completely. 18% were having pelvic organ prolapse symptoms. So again, pelvic organ prolapse is when in people with vaginas where the uterus, the bladder, or the rectum can start to come down into the vagina, where they're starting to get some bulging sensations into the vagina. This study was just published in the International Journal of Urogynecology this year. What they also found was that people modified their exercise because of these symptoms. So with all of these people having symptoms, and if we're modifying exercise, we know that cardiovascular disease is the #1 killer of women in the world. We know that exercise can help prevent cardiovascular disease. But if we're seeing people modify their exercise because of their pelvic symptoms, then we really need to be treating their pelvic symptoms so we can get people exercising. Is pelvic floor therapy potentially life-saving then, right? I would like to think so, if we can get people moving that are stopping exercise because of their pelvic floor symptoms. We know that few people in this study that they just published seek professional help. People suffer in silence. It's embarrassing. They don't want to talk about it. Or they think that it's pretty normal because a lot of people have these symptoms. A lot of their family members, mom had those issues, grandma had those issues, auntie had those issues. And so they don't seek professional help because they feel like there's nothing they can do about it. We know it has a huge impact on exercise. Almost half of all women with past, current, or fear of pelvic floor symptoms, it affects their participation in sport. So similar to what I was saying before, if almost half of women are modifying their exercise because of their fear of or their past symptoms or their current symptoms of pelvic floor dysfunction, then we could be creating increases in all things that we know exercise can be healthy for: cancer, cardiovascular disease, diabetes, etc. 39% of people in this study had a moderate or great effect on exercise. That was a systematic review published a couple years ago. So again, we're talking about, this is, some of those studies are 12 to 69-year-olds. Some of them were more middle-aged people. Check out this study. This study amazed me. Adolescent female athletes. This was published a couple years ago. They took 633 adolescent athletes. The average age was 16 and a half. The mean prevalence of urinary incontinence was 48.5%. This is young girls, 16 and a half years old. High urinary incontinence rates. And then with these people who were having all these this urinary incontinence, most of them had never heard of pelvic floor muscle training. That's why we're doing what we're doing today, is to start to increase awareness, increase people talking about these symptoms. Never heard that there's anything that they can do about it. 87% wouldn't mention it to their coach. It's embarrassing, right? A lot of these people don't even mention it to their parents. So are these the kids who, yeah, you're going to be a really good track athlete, and then all of a sudden they stop running track? Why did they stop? Oh, I'm just too busy. I don't feel like doing it anymore. Could potentially some of that be because they're having symptoms they don't want to tell anybody about. And when they go to do that long jump, they're having symptoms and they're like, oh, I can't do that anymore. Is it the basketball player that says that she doesn't want to play basketball anymore? And could that potentially be because when she goes up to do a layup, she's having issues? And a lot of the basketball shorts are see-through, and they might have fear of having symptoms. Elite athletes. This study looked at 754 elite athletes. 33% of them had urinary incontinence, young. They had an average age of 23. So in this study, they did look at men as well, people with penises compared to people with vulvas. We do see a higher rate among elite athletes of pelvic floor, of at least urinary, with people with vulvas. But we also see that 15% of people with penises are having urinary incontinence as well. Again, the mean age is 23 and a half. Again, moderate to severe. This isn't just somebody that, oh, I might leak a drop once every 6 weeks. 31% of them moderate to severe symptoms in elite athletes. So, talked about how many people are having these symptoms, right? And that it's very common among all athletes, more common among high impact athletes. We know that people don't talk about it. We know that people don't seek care of it. So I'm going to talk about pelvic floor anatomy, what the pelvic floor muscles do. Pelvic floor muscles run from, this is a side view with a person cut down the middle, a person with a vagina cut down the middle, looking at the side view. This is your pubic bone, so the bone in front of your pelvis. And then this is the tailbone and back. The pelvic floor muscles run from pubic bone to tailbone. If we look at this anatomy here, this would be the bladder. I hope you can see my cursor. This is the urethra. This is the vagina, the uterus, the rectum, and the anus. And the picture on the right, we're looking at male anatomy, same thing. The muscles are going to run from pubic bone to tailbone. The bladder, the urethra. There's obviously no vagina. There's a prostate right here under the bladder. And then the rectum and the anus. So muscles run from front to back. And they have several functions. They support our pelvic organs. They stabilize our spine. They're part of our core. They're the bottom part of our core, so they help to stabilize our spine. They provide sexual function. They provide sphincteric control. So the sphincters of the anal sphincter and the urethral sphincter, allowing those sphincters to close and to remain closed in order to maintain continence. And they act as a sump pump to return venous and lymphatic fluids back up to the rest of the body or back into circulation. So pelvic floor, if you think about the functions of the pelvic floor, you can think about 5 S's. They hold a very strong role in our body. It's part of our core. They support our organs. They stabilize our spine. They provide sexual function, sphincteric control in order to maintain continence and be able to help control venous and lymphatic fluids. So the pelvic floor connection to the core. A lot of times when people think about core strengthening, they think about their abdominals, right? So many times we see like, oh, I'm doing my core strengthening, and they're just working their abdominals. But your core has a top to it, it has a bottom to it, it has a front to it, and it has a back to it. When we're thinking about the core, we have to think about all of those muscles in the core in order to be able to maintain that pressure system properly. So if we're forgetting about the top of the core and the bottom of the core, we're forgetting about a huge piece of the core. So if you're somebody that's ever been to therapy or ever worked with the trainer and you're working on core strengthening, but nobody's ever mentioned the diaphragm and the pelvic floor or your low back muscles, and you're just working the abdomen, I would challenge you to say that there's other parts to the core that we need to be talking about. So those are the muscles in that deep core. Diaphragm here at the top, kind of sits underneath your ribs. Pelvic floor here at the bottom, pubic bone to tailbone. Your transverse abdominis is one of your deep abdominal muscles, also attaches to the spine. And then your multifidus are the deep low back muscles. So all part of that core. So typically with breath, we should see movement of the pelvic floor. We should see that as you take a breath in, your pelvic floor responds. So think about this picture that I showed you before with the diaphragm. When you take a breath in, your diaphragm contracts down. And when that diaphragm contracts down, typically our ribs will expand, our belly might expand, and our pelvic floor should also expand and lengthen. So just with breathing, we should get a normal movement like this in the pelvic floor. Inhale, the pelvic floor relaxes. Exhale, it comes back up. Inhale, it relaxes. Exhale, it comes back up. So in this video here, I show you through an ultrasound. What we're looking at in this picture is we have an ultrasound over somebody's bladder, over their belly, looking through the bladder. So the black here is urine. And we're going to see the movement of the bladder base as somebody is taking a breath. So see if we can see that here. There's an inhale, it lengthens. And on exhale, it comes back up. Inhale, it lengthens. And on exhale, it comes back up. So this is one of our things that we do when we're looking at pelvic floor function to assess normal mobility is your pelvic floor moving? Pelvic floor should have a range of motion, just like your arm has a range of motion. Your pelvic floor should have the ability to lengthen and to contract. And so that's one of the things that we're assessing as therapists when we're looking at pelvic floor normals with mobility. So there's a connection to your hips with your pelvic floor. This is looking at the bottom up of your pelvic floor. These are your hip bones here, your legs, your spine. These are hip muscles here. This is your pelvic floor in the middle and the hip muscles over here on the sides. So that piriformis, that obturator internus, they're both hip muscles. They're very closely related. Your obturator internus is the side wall of your pelvic floor. Your piriformis is your back wall of the pelvic floor. If somebody's having hip pain or back pain, it's related to your piriformis, or you're having hip pain and you're not paying attention to the pelvic floor, could you potentially be missing a piece to that puzzle? How many athletes do we know that are having hip pain and back pain? How many athletes are addressing pelvic floor as a potential contributor to hip pain and back pain? These are all muscles that attach to the pelvic girdle. There's a ton in there. And I don't expect you to know what any of these muscles are or where they are, but I'm sure there's a couple of them that you can pick out in there that you've probably heard of before. But all of these muscles attach to the pelvis. So we need to be paying attention to what's going on with the muscles of the pelvic floor because of all of the important muscles that attach to it. So how do you do a pelvic floor muscle contraction? We'd see that many people try to do pelvic floor contractions and they might be doing them improperly. We see that some people are doing pelvic floor contractions that really shouldn't be doing pelvic floor contractions because their pelvic floor muscles are like this and they never know how to relax. But I'm just going to talk about the basics of a pelvic floor muscle contraction. Your pelvic floor muscles should squeeze and they should lift. So again, remember they're the muscles that are running from your pubic bone to your tailbone, right? They should squeeze and they should lift. So if you think about doing a pelvic floor muscle contraction, then it should be you should feel a squeeze and a lift inside. It's a deep inside muscle. So it shouldn't be your belly that's doing the squeeze and lift. It shouldn't be your butt cheeks that are doing the squeeze and lift. It shouldn't be that you're holding your breath and lifting your shoulders and your eyebrows and your toes are curling. It should be that more of a subtle contraction where if I was looking at you and you're doing a pelvic floor contraction, I wouldn't know that you're doing one necessarily, unless maybe I had an ultrasound on you. So to do a pelvic floor contraction, think about the muscles that might close the labia, or pull the penis in, or close the anal opening, or pretend that you're going to stop the flow of urination and you don't want to, or pretend that you're in a crowded room and you need to pass gas but you don't want to. There's a whole bunch of cues, and honestly, not all of them work for everybody, and we'll find the one that works best for you. But it also is important that that muscle, when you feel it contract, that you also feel it relax. So just an idea of what that pelvic floor muscle contraction is. All right, normals of bowel and bladder. Your bladder should hold about 10 to 20 ounces in your bladder at a time before you have to empty. That's a lot. It's over a cup of urine that should be in your bladder when you're emptying. You should void once every 3 to 4 hours. You shouldn't have to just in case, oh, I'm going to go to the bathroom just in case, or there's a nice bathroom here, I better go just in case, or I'm leaving the house, I better go just in case, or I'm leaving the doctor's office, or I just went into the doctor's office, I better go just in case. Once every 3 to 4 hours, no just in case toileting. We should sit or stand without an effort to empty. So it shouldn't be that we're having to strain to push our urine out. It should just come out naturally. Once we sit down or once we pull things out, then the brain sends a message to the bladder for the bladder to squeeze. That forces the urethra to open and urine comes out. It should not be something that we volitionally have to do. We should get up 1 or less times at night to pee. Urine should be stored without discomfort. You shouldn't feel your bladder filling. You shouldn't feel pain as your bladder starts to fill. You should empty your bowels. This is a wide range, but 3 times a day to 3 times a week is considered normal. You should not have any pain or straining during bowel movements. We should be able to control a bowel urge if there have one, and our stool should be soft and formed. So if any symptoms outside of these norms, that might be something that you want to seek treatment for. Sexual normals. There should be no pain with sexual stimulation, no pain with arousal, no pain with penetration, no pain to touch, no pain with an orgasm, or no pain post-orgasm or post-coital activity. You should be able to use a tampon or a menstrual cup without difficulty if desired. And you should be able to attain and maintain an erection and have an orgasm. So if any of these things outside of these norms, that might be something that clues you in that you might have some pelvic floor dysfunction that could be treated. What do we see commonly in athletes? We see that athletes will adopt strategies to manage or to mitigate symptoms of pelvic floor dysfunction. So we might see that they, wait a second, I got to go pee before I do these box jumps. Wait a second, I got to go pee before I run this lap. Wait a second, I got to go pee before I do, this whatever skill that we're doing. We might see, oh gosh, I'm not going to drink a whole lot of water, which is really bad, right? For athletes, we need to keep hydrated, but we'll see people decreasing their fluid intake because they don't want to have symptoms. We might see people cross their legs when they go to do something. They might hold on to their private area, their perineum, because they don't want to leak. Or we might see that they have to put a pad on before a sport. They might wear a pad during their running race, or might wear a pad during their sport to prevent any show of incontinence. We might see that they're like, nope, I can't do that one. Can't do that exercise. I'm not going to do that. Can't do those drills because they don't want to have symptoms. We might see that they don't go to practice when they are having their menses. Because of pain or because of heavy bleeding. We might see them stop sport altogether. I mentioned that before. We might see that these people, no, yeah, I'm just not interested. I just don't like, I just don't like gymnastics like I used to. And it might have other reasons that they're too embarrassed to talk about. We might see that they have pelvic pain, hip pain, back pain that doesn't improve as expected. They've been to see the trainer. They've been to see a doctor. They've been to see maybe even a physical therapist. And it's not making the gains that they want to make. Maybe we're missing the piece if we're not paying attention to that pelvic floor. We see a huge impact on quality of life. We see a big impact on performance. If they're in pain when they go to do a certain stance that they're supposed to do for their sport, then it's going to impact their performance. If they're fearful of leaking when they go to jump, they might not jump as high to get that rebound or to hit that ball over the net, right? So we do see an impact on performance. And we see an impact on emotions, of course. People might decrease their effort. They might stop playing. They might play through the pain or not. Some related diagnoses. I just put some things in here that people might not think of with pelvic floor, but because of all those muscles that I listed earlier that attach to the pelvic floor, deep gluteal, so deep butt, or hamstring symptoms. Piriformis is that deep butt muscle symptoms. Sciatica, I'm sure you guys have heard of sciatica, where the pain, is kind of coming down the back of their leg. Might be painful to sit. Upper back tightness, because a lot, like, it's not just your pelvis, we have everything that's happening above and below, but we might see upper back tightness, and then the pelvic floor ends up accommodating for some of that lack of range of motion. Or that lack of range of motion in the upper back might have symptoms for their bladder or for their bowels that are negative. Shortness of breath with exercise, because that diaphragm and the decreased ability for that upper back and those ribs to be able to move. So as a hip flexor, we might see tightness in those hip flexors, or pain in the hip, or back pain, or tailbone pain, because remember that pelvic floor attaches to the tailbone. So any of these things and so many more could be related diagnoses when we think of pelvic floor dysfunction. So how do we know? How do we know if we're going to be somebody that could benefit from pelvic floor dysfunction? All the things I talked about outside of those norms, potentially. We also have a pelvic floor screen that if you answer yes to any of these questions, it might warrant seeing a pelvic floor therapist to see if there's something that they can do to help you. So do you leak urine with cough, laugh, sneeze, exercise, or with urinary urgency? If you answer yes, you might want to see a pelvic floor therapist. Do you have burning with urination or frequent urinary tract infections? If you say yes, you might want to see a pelvic floor therapist. Do you have urinary frequency or urgency or hesitancy? When you sit down on the toilet to pee, it doesn't start right away, or it doesn't feel like you're empty after you're done, or your stream goes in all different directions, or it stops, and then it starts again. You might want to see a pelvic health therapist. Do you have feelings of pelvic pressure or fullness or heaviness in your pelvis? You might want to see a pelvic health specialist. Have you had a recent baby? Birth changes things. Things just don't go back to normal after 9 months of progressive change happening on our symptoms. Our rib cage changes, our breathing patterns changes, our abdominals change, our pelvic floor changes. We've had a recent birth. Absolutely, you should be going to see a pelvic health specialist, at least for a visit. If you've had separation of the abdominal wall or muscles in the abdomen, you might want to see a pelvic health specialist. If you have bowel leakage or inability to control gas leakage is a similar thing. If you can't control that gas, and it's telling us that something might be going on in the muscles of the pelvis that are preventing that from happening, you might want to see a pelvic health specialist. Are you having straining or pain with a bowel movement? You might want to see a pelvic health specialist if it's difficult. It shouldn't be difficult to pass your bowels. It shouldn't be painful to have a bowel movement. If you have frequent hemorrhoids or fissures, probably need to see a pelvic health specialist. If you're not able to empty your bowels completely, you always feel like there's more in there that you just can't get out, you might need to see a pelvic health specialist. If you have pain during a pelvic exam, I've heard people that have come off the table and been in tears during a GYN exam before, or they haven't been able to complete a GYN exam. You definitely need to see a pelvic health specialist. We can help you. Do you have pain with using a tampon, or not able to use a tampon or a menstrual cup, or pain or discomfort during intercourse? You might want to see a pelvic health therapist. Pelvic pain with sitting or prolonged sitting, you might need to see a pelvic health therapist. So if you answered yes to any of those questions, then there are some great, well-trained therapists in your communities that can help you. So do not suffer with these symptoms. We see these happening with the regular, everyday people. We see it happening with athletes. What can we do in physical therapy to help you? We can improve coordination and mobility of those muscles. Remember I said sometimes people are just so stiff in that area that they don't move. And so then the muscles are not able to accommodate a cough or a jump or a throw or a kick because those muscles are not able to move properly. We might work on the mobility of the spine because maybe it's that spine that needs work on. Pelvic floor strengthening. There's a whole host of things that we do. We might work on breath mechanics and rib cage mobility and thoracic mobility. We might work on pressure control. So what happens when you cough, when you kick, when you throw that ball, when you go up to hit that volleyball over the net, when you do that golf swing, what happens to your pressure? If you cough and everybody can practice this now or later. If you cough and you're feeling pressure coming down through your perineum being the area underneath your scrotum or between your scrotum and your anus, or your vagina and your anus, if you're feeling pressure pushing down into your seat during that, then that is probably happening when you go to kick and throw and push and pull and do all of your athletic moves. So working on how do I control that pressure system in order to be able to prevent that is something that we can do. And of course, bowel bladder training, if those are the issues. There's so many things that pelvic health therapists have in their toolbox to help people to stop suffering in silence and to work on getting back to their quality of life, getting control of their bowel, getting control of their bladder, no matter what sport that they're in, helping with hip pain and back pain because of the relationship with the pelvic floor to that. So basically, my goals are to increase awareness to athletes, increase awareness to coaches, increase awareness to trainers, increase awareness to family members in order to get athletes and frankly, everybody into care that's suffering with these symptoms sooner, to stop people from suffering in silence, to get people to start talking about it. We know that most people don't talk to their healthcare professionals about this. We also know that most healthcare professionals do not ask the questions about this. So we need to be asking these questions. Are you having any of these symptoms? If you are, you need to seek help for them. So that is it.